Good evening, and welcome to Two Pandemics, One Election. My name is Cynthia Thurman, and I am the Associate Director of the Clark Fox Policy Institute at Washington University in St. Louis. Thank you for joining us for episode 2 of this three-part series, which is taking a deep and nuanced look at the upcoming election and how it's being influenced by the racial inequities revealed by COVID-19 and a new movement for racial justice that's been catalyzed by racial violence. The Two Pandemics, One Election series features roundtable conversations to illuminate these and related important issues that are taking center stage in the debates and in the decision-making of our nation's voters. Tonight's event is Redefining Equity, and it explores how policy and health and education equity are inextricably connected in widening the racial and wealth gaps in our country. This is true of social determinants of health, access to quality health care and education, and most recently, the impact to families of school closures and remote learning. This roundtable will drive a conversation towards a political agenda for health and educational equity that creates safe and thriving communities going forward. We have convened a powerful panel for tonight's roundtable, and in addition to our deep appreciation for our guest speakers, I would like to thank the collaborators and co-sponsors behind this three-part series: the Center for Race, Ethnicity, and Equity, the Clark Fox Policy Institute, and the Gephardt Institute for Civic and Community Engagement, all of Washington University in St. Louis. Before we meet our guest speakers, I would like to introduce you to our moderator for tonight, Darrell Hudson, Associate Professor at the Brown School at Washington University in St. Louis, and co-director of the Collaboration on Race, Inequality, and Social Mobility in America within the Brown School Center for Social Development. Thank you all so much, and take it away, Darrell.
Thank you so much, Atia. Welcome and good evening to everyone. Thank you all for joining us tonight. And this is a really important conversation, and we're really grateful for the second installment of Two Pandemics, One Election. We'll share a little bit of information later on about the third installment. But tonight we're talking about equity. Equity is definitely on the forefront of many Americans across the country. The COVID pandemic has underscored underlying social, racial, ethnic, and other types of inequities that we're battling with right now. In many ways, people say that we have twin pandemics, one familiar, one literally novel. And so tonight we're very fortunate to hear from a number of different speakers who are at the forefront thinking about equity and privileging that work. So without further ado, I'd like to go around and have each of our speakers introduce us. After that, we'll jump into our conversation. Dr. Rogers, would you like to start?
Thank you, Darrell, and good evening to everyone. I'm really excited to speak with you guys tonight. I'm Dr. Cynthia Rogers. I'm an Associate Professor of Psychiatry and Pediatrics at Washington University. I'm also one of the Associate Directors of the Center for the Study for Race, Ethnicity, and Equity. A couple other things that I do that I think are relevant to tonight's discussion. I'm the Director of the Perinatal Behavioral Health Service, which is a clinical service that serves pregnant and postpartum women with mental health and substance use disorders. And additionally, I'm an Associate Director for the Intellectual and Developmental Disabilities Research Center.
Thank you so much. Next, we'd like to hear from Dr. Art McCoy. Thank you for joining us.
It's a pleasure to be with you and to the august esteemed panel that we have, and to Washington University. I'm Superintendent of Schools for Jennings School District, and I am also a fellow with the University of Wisconsin's for the Institute of Poverty and Geography, as well as the president and founder of SAGES, which stands for Severing Attainment Gaps That Exist in Society, which I like to use as a definition for action to close those gaps that exist in society. It's a nonprofit it's a nonprofit 501c3 as well as an LLC. But it's a pleasure to be with each and every one of you tonight.
Thank you so much. And Dr. McCoy, you're a man in demand. You'll be taking a break from us about 6:35, right? So just to let our audience know that we'll see Dr. McCoy hop off for a second to do a media interview, and then he'll rejoin us a little bit later. Thanks again for joining us.
Thank you.
Next, we have Dr. Leopoldo Cabassa.
Hello, everyone. Good evening, and thank you so much for the opportunity to talk with you guys today. and Darrell and Cynthia and Art. It's great to be part of this panel. My name is Leopoldo Cabassa. I'm an associate professor at the Brown School. I'm a social worker by training, and I also co-direct, along with Byron Powell, the Center for Mental Health Services Research at the Brown School. And I do work, my focus of my work is implementation science and health disparities. And I'm excited to be here today and to contribute to this great discussion.
Thank you. And thank you all for being here, both in the audience and of course for our esteemed panelists. So without further ado, let's get into our discussion. So discussions of equity are central to many political discussions and party platforms taking place across the country right now. How would you say you define equity? And do you think that the definition of equity that's being currently used in different political spheres is adequate? Is there anything missing, whether it's in the education perspective or from a health perspective?
So I can start. I really am thinking about this in terms of health equity. And one of the things I think we spend a lot of time focusing on when we talk about health equity is access. And a lot of time thinking about how can we expand health insurance, how can we expand access? And I think that really ignores some of the really important challenges that we face in terms of health equity, because we can give insurance, we can give access to care, but if we don't address equity in terms of equitable treatment, respect that's given during treatment, as well as equitable outcomes, which conversely may actually require not always giving equal treatment to folks, but giving them the treatment that they require, which might actually be more for those who are currently not receiving a lot of the treatment that they need. And so I think I would love to get the country to get beyond just providing health insurance when it comes to health equity and thinking that that's going to solve all of the issues around racial disparities in care, because it's really about what happens once you walk through the door, what happens once you enter the medical system. Are you getting the treatment that you deserve from providers that are not coming at you with biases that are keeping you from getting the medication that you need or the workup that you need? And are they really addressing all of the other barriers and challenges, transportation, housing issues, other things that are actually keeping you from being well? And so that's kind of my thoughts in terms of how we're defining equity and how we really need to expand it when it comes to health equity.
Thank you so much. And perhaps Dr. McCoy can hop in and give us a slightly different perspective.
Sure. I define equity as meeting the needs at the speed of the need, simply put. Because it's not enough to just meet the need. You have to meet the need at a level of speed that answers the demand of the need right away. So it's a resource and it's a time factor. I also poetically define equity as what love looks like in public amongst strangers. So the issue of love means to give and to give endlessly, but to do so amongst strangers takes it into a domain that it's not based off of some affinity. It's just based off of giving for the sake of giving to those you don't even know. In a church setting, I often for 10 years have shared that a man asked God what heaven looked like, and God miraculously translated this person into a room with a pot of stew at the center of the table. And individuals had long spoons and were like 200 feet away from this pot of stew, attempting to dip into the stew and then bring the spoon back to feed themselves. And they were in agony and pain and yelling and screaming, and they were malnourished and they were hungry. And that was hell. And then God translated the person to another room with a smaller pot of stew with even longer spoons, and this pot being at the middle of a table and a round table with millions and millions of people. But in this instance, people were dipping their spoon into the smaller pot and reaching across the table to feed the other person, and each person had according to their level of need. That is equity. It's what love looks like amongst strangers. And ultimately, it's meeting the need at the speed of the need. So access is not enough, and equality is not enough. And if you go back in time, equality was the civil rights movement of the 60s. You go back before that, adequacy is not enough. Adequate housing and so forth, the Jim Crow era. If you go back before that period into slavery, the right to live and be a human is not enough. Human dignity. And so ultimately, I believe equity is a word that we've evolved to understanding to try to perfect this sense of what's good, what's right, what's just. And we've been on this pendulum of this continuum of human adequacy. What about equity, free and appropriate public education? What about equality? And now this term of equity. So it's a theory. It's not a reality. Just like justice is a theory, and it's not a reality. We operate in the theory of justice, and we're trying to perfect the theory of equality, but also equity.
Thank you so much. And I'm certainly going to steal that definition, but I will cite you for that. That was a really good definition of equity. Thank you. Dr. Cabassa, thoughts about equity?
Yeah, I couldn't have said it better. Dr. McCoy has really provided an excellent definition and also a challenge, I think, as well, how to make it timely, useful, and to move, as Cynthia mentions, beyond access. It's really about the use, the quality, and the outcomes of care, particularly in the healthcare and mental health care system, to really examine what happens after someone gets access, making sure that they get the appropriate care that meets their needs in their time and in a timely fashion. I think that is exactly what equity means. One thing that's missing, I think, from our discussions is to really bring the voices of the people who we are serving, who are needed in this discussion, to really partner and provide that work from the ground up, from the communities that are most at need and will most benefit from equity, that they're part of this discussion in developing the definition, but also the programs, the services, the policies that are needed to achieve that dream of equity. I think it's really important. So there's a lot of work to be done, but really focusing on, and to me, it's around fairness. What is fair to the needs of a particular population, community, neighborhood, and what can be done now to really address those needs. I think that to me is at the heart of the work that's been done in equity and the promise of equity moving forward.
Thank you. Thank you all for those definitions. And one question that I had in mind, and Dr. McCoy really brought this to light again, is a lot of people think about equity and they think they have to give something up. So people who are, using that analogy of someone across the table getting fed, someone thinks, well, I don't want to give up my portion. And as Americans, it's so deeply ingrained for us, these ideas of meritocracy, pulling yourself up by your bootstrap, these ideas around, you work hard, you play by the rules, and you get the outcomes are different because the efforts are different. So any thoughts about how to kind of, I don't want to say attack, but how to take on that narrative when people say, I don't want to have to give up anything because I've earned what I've got? Dr. Rogers, go ahead.
I mean, I think there's a couple fallacies in that belief. One is that you alone are responsible for your own outcomes, and that there are not inequities built into our society that have allowed some people to advance more than others. So I think that is one of the challenges for Americans, is to be honest and recognize that there is built-in unequal treatment already. And so for those that feel like you did it all on your own and you're giving something up, is a lack of acknowledging of what you've been given, what privileges that you have that can come in, in several different forms. And then I think the other issue is, at the end of the day, if we can increase the empathy that we all feel for each other, and recognizing that as other people do better, just knowing that often, you know, it makes us feel better. I think all of us that go into the helping professions, you know, people always think of them as you're doing something selfless, but you're really not, because it really does make you feel better. It enriches your life to help other people. And I think to remind Americans of that, I think is important as well. So I just don't buy that argument for a lot of reasons. But I do think we could do better in approaching that argument. I don't, you know, certainly don't think just calling people selfish or uncaring is the way to change minds. But I do think that, you know, that individualism is a bit of a fallacy.
Okay. Thank you. Dr. McCoy.
Yeah. I mean, it's a great point. And I like going deep on things, and we are professors, scholars, and so forth, and this is a university, so let's go deep. In a capitalistic society, there are winners and losers. You do give up something because it's not a communal way of living. It's a game or a system or a society based off of haves and have-nots, and the haves always profits off of the have-nots. So as you introduce equity in a capitalist system, there will be a giving up of something. The question is that giving up what you ought to do for justice and fairness? Because technically the goal is to have less input for more output, the efficiency game. How do I make more money with less effort? How do I get more things with less effort and energy and use? And that is the definition of power within the domain of capitalist societies. But in a more communal sense, true to my African brothers and sisters who ultimately came over to this place and was like, I'm ready to share anything and everything, but you're taking away everything in the sense I'm not even human anymore. We lost that game. We lost the right to be a human because we refused to play in the domain of capitalist thinking. And therefore you have, you know, 1776 having the Declaration of Independence on one end, but that wasn't the real Constitution of the United States. It was Adam Smith's Wealth of Nations. That was our Constitution. And so with that Constitution, that this is who these people are, this notion of equity becomes a situation where you lose for 400 years and you become the definition of what sacrifice is to make the dreams of the American ideal true. That's the position that we are in as people of oppression, creative veterans of suffering. The suffering makes the American ideals true because the Constitution was the wealth of nations, not the Bill of Rights or the Declaration of Independence. So I'll say this: when you switch over to something that's more communal living, it is true that in a community, if you give me and I give you, then I have less of a need to kill you. And let's just keep it real. I mean, that's what it was about, you know, 3, 4, 5, 6, 7, 8, 10 millennia ago. It's about killing you to get what I want and what I need. And now we've become a little bit more sophisticated where we only do it to Black people. And so Black lives don't matter as much as Black work matters. So essential workers means we will kill you, you know, through coronavirus so we can keep getting what we want, or we will kill you. And that knowing that, you know, 1 out of 6 Latinos are in that situation and 1 out of 5 African Americans in that situation, we know that your work matters, your labor matters. I look forward to shifting from the individualistic view, the materialistic view, and the warmongering view of killing one another to get what we want, so that we can eventually get to a place where true equity and brotherhood and sisterhood is actually in our neighborhood. And so, you know, I'll end by saying, this even goes into the psyche, and I love our psychiatrist is here working in that field. It goes to the issue of white cops killing Black men and women. You don't see Black cops killing white men and women. You don't see female cops as often killing men or women. Female cops could argue that they are the most afraid for their life, the least in stature, and they got a gun, they got power, but they're not shooting people recklessly. It gets to the issue of superiority. I feel like what I want is superior to who you are and what you are. Therefore, I will go so as far as to kill you in order to sustain that mental framework. And so that's, for me, at the core of your question. It's the question of, am I courageous enough to not act on instinct and impulse of superiority complexes to ultimately share this planet, this space, this resource with you?
Thank you. It's a lot of food for thought. Dr. Cabassa.
Lots Lots of food for thought there. So I do want to address one important point, which is the change of the metric of a zero-sum game here. That it is more of a social conditions that create the equity component and the causes of many of the things, and that we're all here together in many ways. Yes, we have more or less, and privilege or not, but all benefit from changing the conversation towards a more social and just system. I think that's one component of this important conversation. And that the metrics that we use, how do we, and this is a very US-based component, that everything is around the economics and around, but what about other metrics of quality of life, of equality, or equity in terms of our opportunities, our mental health and health indicator? We need to do better and change the conversations around what is it that makes something equitable for everyone, not just in economic terms, but more in social health and quality of life terms in many ways. And then there's other things, of course, that we need to address in terms of the power structures that drive our systems. We need to shift those power structures. So in the work that we do, for us, the equity component is pragmatic approaches to really address the root causes and the social conditions that give rise to this. And that we can and understand that all benefit when everyone, when we have a more just society for everyone. So
yeah, I really like what Leo said.
If I could,
oh, I'm sorry.
no, please do. Go ahead.
Oh, just quickly, this might be the psychiatrist in me, but I was just going to say I really like what Leo said about the focus on well-being as a metric instead of economics, but I think that in order for us to view, we need to focus on that as a society as something that we value, even as individuals, right? Before we can even say that we value it for other people. And I think that that's something that we, as you know, as our American society, do not yet value our well-being above, you know, our salary, or, you know, how large our house is or how big our cars. And so until we do that, you know, we can't value it for others either. So I think it's, you know, I think we have to think about it both from within ourselves as well as within the community.
Dr. McCoy?
Yeah, I was gonna say almost the same thing from a different vantage point, to say that I think that what Professor Cabassa is sharing is definitely needed, and it's a goal. But I think about, you know, the recent vote of Medicaid expansion that we just passed here. But the fact that we were the last state, or one of the last states in the country to do so. And then the fact that, you know, universal healthcare is like a hard thing for us, that we're still debating that in our public discourse, and we were like one of the last first-rate countries in the world to do so. That shows you the tension between the power that be and the powers that be, the capitalist profitizing of it, the people in power, be it the top 1% or the top 5%, the corporate power, which is now equivalent to an individual. Corporation has the liberties and the rights of an individual according to the Supreme Court and others, versus this notion that the professor is mentioning of well-being. Simply put, I quit on the first day of being an actuary scientist for that very reason, of having to go calculate how much to charge someone to have the company benefit, but have the person have something called insurance, when I saw that the value of a black male's life was the amount of a Toyota. And I said, that's no greater than it was during slavery, with just some amortized future value of dollars. And I quit and became an educator at 19. And ultimately, worked on the other end of the equation. But it's an equation that's constantly being lived out, worked out, argued out, fought out. And we have to fight. We have to push this view, because it is a higher, more enlightened view, I believe.
Thank you. And I really wanted to transition something that Dr. Cabassa said, thinking about what do we do? So changing the narrative is one thing, but what are some specific policies, practices, et cetera, that we need to be thinking about to make progress towards equity? Dr. Cabassa, I'll put you on the spot since you raised that point. What do you think there?
Sure. No, I think from the healthcare component, I think we need to address the elephant in the room of having high quality healthcare access for everyone, not just the people in the United States, but every person in the country needs to have that access to high quality care. And it is true, and as Dr. McCoy was indicating, we're still arguing this in the United States in the middle of a pandemic, where health is critically important for the livelihood of the entire country. And we're still not addressing the core element of health is such an important right for every single person in this country. And healthcare for all, regardless of your stature, regardless of your race, ethnicity, gender, immigration status, it should be a right for every single American. And I think that's a critical component of equity. Education is another major one. We need education for everyone. Make it accessible, affordable for every single individual. It is extremely critical for doing that. Many of the discussions that we're having is because of the lack of education that we have in this country. Basic education about our history, our culture, our country, our civic duties becomes really important. So those are two major ones. The third one that I was on is voting. I think everyone needs to be, it needs to be an essential element. And to me, this is personal, being a Puerto Rican and not being able to vote for 18 years of my life until I got to the United States to vote for being a US citizen without the right to vote. For me, that's an essential element. Every US citizen should have the right to vote, no matter where they live or where they're at. And that's a critical aspect of this. We need to be part of that conversation. So those to me are three major ones, and there are many others, but those are major ones that need to happen.
Thank you. And just as you mentioned voting, Teresa dropped into the chat, washuvotes.worcester.edu for resources related to voting here on campus. Dr. Rogers, any notions around policies that are necessary to make progress towards equity?
You know, so obviously I agree with Dr. Cabassa in terms of the need for healthcare for all. But as I mentioned earlier, for me, that is really broadened, you know, beyond just having insurance, just having access. You know, in terms of the actual provision of care, we still have a lot of work to do. So policies that I would like to see have a lot to do with institutional policies around how do we provide education for the clinicians that are going to be treating patients, and in doing so more than just as, you know, you're required to do 2 hours of implicit bias training and we've checked a box. Because where we see a lot of the disparities in terms of outcomes really a lot of that is at that sort of provider patient level, not just the lack of insurance, but the actual treatments that are provided. And so I would like to see a real focus, a centrality to the mission of institutions is providing equitable care, of being anti-racist, and building that within the institution as the focus of the care that you provide. And in truth, even, you know, for the research that we're doing, certainly something we're trying to really advocate for with the new center. Is race just a checkbox, just a covariate, or is this something that you're truly focusing on, trying to understand how racism is impacting not only the health outcome, but the mechanisms that are leading to the disease or the lack of wellness? And so I think it's, for me, the policies, you know, even beyond governmental policies that are obviously necessary when it comes to improving housing, improving childcare, improving education, that all lead back to health outcomes, but also the provision of health and how we need to really have more of an anti-racist focus within the provision of health.
Thanks so much, Dr. Rogers. And just at the risk of tooting our own horns here at Washington University School of Medicine, we've got a new gateway curriculum that we've been working really hard on restructuring and really privileging this anti-racist, community engaged perspective and trying to retrain physicians so that they're better able to serve the needs of the communities they're seeking to serve. Dr. McCoy, any ideas around policies that are necessary to advance towards equity?
Sure. Yeah. I mean, of course, everything that was just said is important. I think that it's essential to have policies that focus. Really, first and foremost, you have to look at your greatest area of needs in any institution. And whatever that institution is, be it education, healthcare, government, any institution, universities, if you look at your population that's least represented, that's got the greatest area of need, be it academically, be it physically, health-wise, physiologically, resource-wise, money-wise, housing-wise, food-wise, and you make policies ultimately to always give them more, no matter what money you spend, because your money is where your morals are, to always give them more than you give anything and everything else. I mean, serving on 30 boards, which I do, national and local, one being BJC, and Children's Hospital Chair of the Social Public Health and Public Benefit. If we track the dollars and see where the money goes, and you see that the money goes to people who are less privileged, then you're doing something better, or at least you're making an attempt. If you put the money where the people are most privileged, if you don't even go to where people are that are in greatest need and you ask them to come to you, then you need to write policies that force the institution to put the money, put the resources, put the representation, put the expectation where the greatest need is. So that's a level above giving you a policy, but I'll give you a policy because now that's the calculus of the integral level. Now let's go one level down of derivative. So that looks like making no hire until you have the Rooney Rule, where you have minority representation in the interview pot before you make a decision on every position that you hire for. That looks like the rule of literally having community-based centers for school clinics, like we have two of, the only district in the state that has two, the only district in the state that has a dentistry clinic in our school system, the only one in the state of Missouri that has parent-child interaction therapy with psychiatrist Joan Luby, only 3 out of the country. But and of course, using $600,000 from the Children's Hospital Foundation, because that money is there to move to where the people are. And ultimately, if there's one death, let alone one death every 2 hours, that an African-American male aspires to active homicide, then that $30 million of that foundation needs to go to where that need is, that data, that statistic, that reality, that community. So the policy is whatever it looks like to give more money, more resources, more representation, more access, more positions to the people who have it the least in every domain. Just do it. And if it can't be done, here's the issue that I say. These millions of feet on the street aren't for small change. The largest movement since the civil rights movement, and larger than that, we don't have millions of feet on the street for small change. This is about big bills. So let's not settle for small change like cents. It's about big bills in dollars, but it's about big bills congressionally. It's about big bills in policies and institutions that give the power back or relocating it and reallocating it to the people who are it's serving most in greatest need.
Thank you, Dr. McCoy. I know you've got to probably run in just a moment for your next engagement and come back to us. I think that was a really good way to think about focusing the light of our resources onto those who are most vulnerable. Some people call that curb cut effect. So if you think about someone who's confined to a wheelchair, being able to make a cut in the sidewalk that won't just benefit that person in the wheelchair, but also benefit the person on the bicycle as well as the person who's pulling their luggage. So by focusing our efforts and resources on those who are most vulnerable, it can encourage all boats to sort of rise. So thank you for planting that seed for us to thinking about politics, and we've got this election. So the one election subtitle of this. How do you think equity has come up into discussion in the past 2 debates? So we've had one presidential debate, we've had one vice presidential debate. How do you think it has or has not been brought up? And what do you think that the political parties could do to better privilege this work?
Well, I don't really know if it was brought up too much in the first debate. the presidential debate. I'm not sure much was brought up in that debate, to be perfectly honest. Although I will say, I do believe at one point, Vice President Biden did make mention that if we were going to, the need to focus on equity in America finally living up to its ideals of equitable treatment. But it was, I think, not much depth given in the presidential debate. I think in the vice presidential debate, there was some discussion, particularly more about taxes and the distribution of our resources in terms of it not having that being allocated to the top, but instead being distributed to the rest of the country. And so I think there was some discussion of that. There was obviously discussions around racial justice a little bit more in the vice presidential debate. But I think we all sort of as a country lose out in the way these debates are structured to give very sort of short, scripted answers to policy questions that really all by themselves would take hours to discuss. So I don't think that the debates are really our opportunity to understand what the candidates truly believe, what their policies truly are going to be, or what the impact of their policies are going to be. So I think it's unfortunate that that's the way they're structured. And ideally, you would have debates that were thematic and where people could really discuss issues, policies with more depth. So I don't see how we can have a really good discussion around equity until they do something like that. So, that's my sort of take on how the debates went.
Yeah, thanks. And I think that connects really well with what Dr. McCoy said before he hopped off. Talked about feet on the street, and you think about the eyes on the screen for a presidential debate. So how many millions of Americans are tuning in and not having a meaningful, intentional conversation about equity is really quite a missed opportunity for sure. Dr. Cabassa, any thoughts about what you've witnessed and where you think we can go to improve things?
Oh, I mean, I completely agree with Cynthia. The debates might not be the right forum, particularly in this political environment in which we face ourselves now, because this requires a more nuanced and more deeper conversations, and it needs to happen sort of at the level of the nation, but at each community, and how equity is impacted at each element of our communities throughout the United States. So I think it's a really it's a shame that our leaders are not putting equity at the forefront of everything that's happening due to everything that's happening right now. But I think there's other venues that need to happen for these conversations to happen, to occur, and to provide more discussions of equity throughout sort of all the elements of our society. But it's a critical aspect of what we need to be. So.
Absolutely. Thank you. And thinking about how people typically frame conversations around equity. And so sometimes you get, especially with the polarization of our party system in the United States, you get people who are satisfied with our progress and say we're much better than we used to be. So what's the hurry? What's the urgency to kind of make progress right now? And let's just claim all the feet in the street that we see. And then you have people who that urgency is really real, and people are like under feeling the immense pressure of multiple generations of oppression. And so just as kind of bringing down, I like what Dr. Cabassa said, thinking about levels of influence, thinking about the local level all the way up to the national level, and the need for a nuanced conversation. So we all know what's happening in the United States. Is there any kernels of progress that you're seeing here locally that you think are really important to highlight? Any lessons for the broader nation to garner from the progress that you've seen here in St. Louis? Or are there places that you've seen around the country that we can learn from?
So I'll give you a couple. I think there are definitely areas where we've done, there have been some progress being made in multiple places, and the work that we're doing in first episode psychosis, for example, expanding services in different states and building an infrastructure for both families and individuals to receive the care that they need during a really difficult time. I think that is areas where we're seeing better care and the infrastructure and what can be done when you bring families, providers, states together to address that are important. And I think it's the local views of really understanding the problems and trying to find local solutions. That's one that I bring from the work that we do, that we've seen. And it's not perfect. None of this is perfect, but at least it's a beginning structure. And that has built on understanding evidence, building an infrastructure, rolling it out in the community, providing input from the community members to how to improve the care and continue to build it. So it's sort of the models of what needs to be done as an example.
Yeah, thank you.
I agree. I think one of the things that I've seen increasing in the 20 years that I've lived in St. Louis in terms of the medical center, both clinically and from a research perspective, is greater engagement with the community and more of an appreciation for the partnership that needs to occur with the community when thinking about how to improve clinical care or how to be more equitable in terms of research participation. And so that's something that's been, I think, heartening. The other thing that I've seen is more collaboration across institutions and community agencies to recognize that we cannot tackle issues around equity as individual institutions. So when you think about Flourish, for instance, the initiative focused on infant mortality, when you think about another initiative that was started by community agencies that we participate in, which is the Perinatal Behavioral Health Initiative, that brings together varying community agencies, as well as us at the medical center, that are really focused on pregnant and postpartum women with mental health issues. But the way that that's been a collaboration, I think, has been very strategic and a recognition that we will be able to tackle these problems if we work together and align our, not just align our values, but align our strategies and align our work and share our data and share our tools with each other and be more integrated. And so that's something that I've seen, at least, and of course this is all within healthcare, but that's something that I've seen that I don't see any other way that we will be able to tackle these kinds of issues without that level of community partnership and integration across institutions. Our medical center is very large, but if we don't partner well with the federally qualified health centers or the community mental health centers, we're not going to be able to make the kind of gains that we want to see in helping the community. And so that's something that I've been really excited to see, and certainly it's not perfect and we need to continue to work on it, but that's the kind of collaboration that we're going to have. And then we have more power as a collective when we want to see policy change, when we work together like that as well. So we've seen some legislation, even here in Missouri, to expand some access. Even before we passed Medicaid at the voter level, there was some ability for us to push the legislature to expand Medicaid for substance using, pregnant postpartum women. But that took us all coming together as a collective of practitioners from across institutions and agencies, and our advocacy as a group is much more powerful. And so that's, I think, the blueprint if we're going to really sort of tackle these great issues, is to really be collaborative across all levels.
Okay. Thank you. And I think that raises another point for me, which is thinking about, and again, we talked about the kind of big national stage of the debate, and perhaps that's not the correct forum to have a really deep, nuanced discussion about equity. So thinking about, you know, when you're at the community level and you're doing these intentional discussions around building trust, building rapport, establishing norms of communication, norms of respect, and those types of things, do you think that sort of is necessary at a, how do you get to a national conversation about equity? So if we can agree that the debate format is not the right sort of format for a deep discussion about equity, but we've got these really rich, kind of more local discussion points in these engagements. Is there a way to kind of take what we learn at a more local level, whether it's in a single system like a WashU or a BJC system? Is there a way to kind of get that above the system level and get it to a broader perspective so that we can have some of those intentional conversations?
Well, I think the model would be similar in that what you would still want collaboration across organizations, right? And so one of the things I think that's been pretty remarkable about this era that we're currently in is you're seeing similar messages across multiple different types of entities, right? So you've got folks in the sports world that are coming out, giving the same message that you see people in the business world promoting, that you see people in government. So I think you have to think about what partnerships can we form across national organizations, advocacy organizations, healthcare organizations, so we can have a collective message that does get above the fray, that gets above sort of the individual, conversations that people are having. So we're having a national conversation. And I think that is honestly what is happening right now. Now, how you move that to policy, obviously the election is one of the ways that we can do that. And so, I think that that's what's been modeled right now, and what is truly remarkable. Now, the goal for us as individual citizens is to make sure that we move beyond messaging to truly see changes in policy. But I think that the conversation that needs to happen from a national perspective, at least at the broad level, in terms of, at least recognizing the need for racial justice, is happening. The specifics that we have to address, that's the next step in the conversation.
And I completely agree. I think that bringing all of these stakeholders together, I think through multiple mediums, like what we're saying, like Cynthia was saying, what we're seeing in sports, what we're seeing in media, what we're seeing in the arts, in music, I think those are the larger voices that can communicate and provide that narrative at the national level, but then provide the real stories at the local level, practical, pragmatic examples of where things are working and where things have changed, and the struggles that people are facing. I think bringing the human side of things, bringing these ideas back to how does it impact a family? How does it impact the youth of our country, the elders? How does it impact immigrant families in different parts of this country? I think that it's a really important aspect of not losing sight of, at the end of the day, who are we actually working with and working for and partnering with to address this issue. So I think it's a constant narrative that needs to happen, and then examples of actual work, and not shy away from the struggle and the difficulties that this is a long process. It's not a simple solution. One size fits all. It's not gonna happen. We have too much of a diverse country for that. So different examples and opportunity. I think that brings it to a national conversation and a local action to make it happen in many ways.
Yeah, thank you for those perspectives. Dr. Rogers, did you want to chime in?
No, I mean, I was just really agreeing with what Leo had to say. I think figuring out at a local level how you're actually going to implement policy changes, but it's made easier when it is the focus of the national conversation, because then you have entities like BJC coming out saying that this is a priority that they're going to make, you know what I mean? So I think that it can be bi-directional in terms of the national influencing the local and vice versa.
Yeah, absolutely. And thank you for those perspectives. And I think just as Dr. Rogers, you were talking about this kind of bi-directional relationship, sometimes what's happening at the local level inspires what's happening at the top. And what we've seen even recently, if without the specific policy prescription, sometimes just the fostering or creation of new ideas can help. Like for instance, over the last week, the New England Journal of Medicine came out with an article on reparations. And so many equity scholars have been talking about reparations as a viable solution to inequity for a long, long time. To see that kind of echoed at arguably the nation's, or if not the world's, most powerful medical journal really does speak volumes to this moment that we're in across multiple sectors, ranging from, as you mentioned, athletics, all the way to healthcare and everything in between. So I think that's a really good point to emphasize this bi-directional relationship. Another piece that, and Dr. Cabassa inspired this question, which is about narrative. And you mentioned this a number of times, Leo, thinking about changing the narrative, thinking about advancing the narrative on equity and the importance of it. And I agree with you wholeheartedly. I know you've done some of this work in your own research. I'm wondering, especially around framing, a lot of people don't understand, because as you mentioned before, notions around equity are really complex and really nuanced. And so there is no easy solution. There's no one size fits all. Any kernels of experience that you can offer to our audience that you've used, and Dr. Rogers, you can chime in on this as well, thinking about ways that you have used the power of narrative to frame complex issues, especially right now. I think that's something that people are really trying to wrap their minds around. How do we change the narrative, and how do we, simultaneously embrace the power of narrative?
No, I appreciate that question. It's a really important one. From some of the work that we've done, I think there's several things that we've learned. One is who's saying the message. Like, who are we? Is the person presenting the narrative someone that people can relate to? People from the communities that are actually struggling with it, that have credibility, that have resonance, and that inspires. I think that's one element. Other, to make the narrative real. And in a sense, this is, I think, where our colleagues in marketing do this very well. Make it something that attracts the person that is listening to it. That it's not a dry conversation or a PowerPoint presentation or something like that, but it's really embedded in entertainment content, because you're informing and entertaining at the same time, something that we've done in our work, and that actually reduces the resistance that people have to these messages, and opens up sort of the conversation, opens up the opportunity for that message to get through. I think that's important. And then culture and language are so important in this component. What is the actual words that we're using, the expressions, who's saying it, and in different languages. So in the work that we do, I think it's really important to convey this message both in English and in Spanish for our Latinx community, and in Spanish that people can understand and appreciate and use that. And I think that's a really powerful approach for examining these elements of it. And knowing that there's limitation, the narratives begins a conversation and a dialogue. Then is the follow through, what you're going to do, what are some concrete steps that you can take to address what, in some cases, looking for healthcare, addressing a particular problem, seeking help in something. So concrete things that people can actually do, actionable items. I think it's a important, and partnering. I think Cynthia says the word, we need to partner across our disciplines to bring some of these conversations into it, and to continue to value the wisdom and the expertise that community members bring to these conversations and to the solution. That's really important. some of the best interventions that I have been involved with do not come from the expert. They come from community that really understands the problem and then bring that evidence into bear and collaborate with science to create better programs. And I've seen that over and over again in some of the work that we've been involved in. And that's so important, that we don't have all the answers as experts. And actually, it is in the collaboration that we find the solutions.
No, thanks so much. Dr. Rogers.
Yeah, I don't have much to add to that. I mean, I certainly within medicine, hearing directly from patients is often the most powerful way for physicians to gain a better understanding of the inequities that patients face. You know, we can present data and statistics and percentages and all those sorts of things, but it's, you know, once you directly hear from a patient about either, you know, an interaction with a clinician where, you know, bias and racism was evident and impacted care, that those are usually the kinds of things that really wake up folks to understand what kind of, you know, systemic issues, you know, we need to deal with within healthcare, for instance. And same within research, you know, our research program, I run a lab with another physician that focuses on infant populations that face a lot of adversity. And so we have families that face a lot of adversity. And it's working with those families and hearing about the challenges that they were facing on a daily basis, which motivated many members of our lab to feel like, you know, we as a lab want more education around this. And we want to be very proactive about providing assistance to these families, even though that's outside of our, you know, our research focus and mission. And so it's, I think, directly hearing from folks who are experiencing the inequities, that they can give the best voice to what they're facing. And once we usually put a human face to an issue, that tends to be when people are more motivated to change. We can tell people how much money this costs and how much money that costs, and sometimes that can be somewhat motivating to policymakers. But if anybody was watching those hearings today, you know, it was everybody had a picture of a family, of a patient, of a child to describe the impact of what was going to happen, because they know that those are the kind of narratives that move people, that are impactful.
Yeah, absolutely. Thank you all for those perspectives on narrative and what's needed to change the narrative. And I think both of those perspectives highlighting the importance of patient stories, the end user story, thinking about the people with the lived experience and how that lived expertise is really important. And also thinking about, and Dr. Cabassa said this, thinking about different audience segments. So knowing that people come from different cultures, being able to tap into, so being very knowledgeable about what that audience is going to, what's going to appeal to that audience and what's going to resonate with that audience, what's going to be credible there is really important to think about as well. So one of the last questions that I have, and Dr. Rogers kind of paved the way for this one here, is thinking about our role as scholars, providers, and leaders who care about equity. How can we better promote equity in our work? So in our research, in our practice, anything, any kernels of knowledge that you will offer to people thinking about, especially for younger, early career people, thinking about what can we do as practitioners, as leaders, as scholars to better promote equity in the work that we're doing?
So I guess I'll start off from a research perspective. I was recently asked to give a talk to a national research organization talking about inclusion of research participants. For a long time, and even still, for a lot of research studies, for instance, won't recruit people that don't speak English as their primary language. You know, so that's obviously excluding an enormous population of importance, right? So we're not doing research on an entire population within the United States. Or people shy away from, certainly within medical research, populations that don't just have that one problem, you know, because the research is too, quote, messy, right? And so again, excluding a whole population of people that we should actually be doing research on. So trying to motivate inclusion of research participants that reflect the country, I think is something that we have to be really intentional about. Funding organizations have to also be very supportive of and push that forward. The NIH needs to be very clear that that is, they have had sort of said you had to explain the demographics of your population, right? But it felt very, again, checkboxy, just explain why you have a certain proportion of minorities in your research and, when you propose your grant. But but it didn't feel like it had any teeth to it in terms of really making sure that people are conducting research in a way that reflects, the population, and also reflects the populations that are most vulnerable to the conditions that we are researching. So I think that's one issue. And then from a clinical standpoint, it's in some ways it's trickier, but I think it's takes some self-examination about how we're providing care. So I think I kind of mentioned that. So I'll stop there so that others can chime in as well.
Yeah, I think I completely agree with Cynthia. And the other component is, how do you practice your science? Like making sure that the questions that are being asked are taking into consideration the need of the community. If there's ways to involve community members in the formulation of the work, of the question, and how that project is actually put in the field, I think it's really important to have that. To model diversity in our research teams, that for multiple diversity, not only race, ethnicity, and gender and age, but also lived experiences. I think it's really important as well. That informs the depth of the questions that we can ask and the methods that we use and how we do that. So I think that, to me, and those are ideals that are sometimes very hard to practice, given sort of the institutional rules, institutional policies, and how academia runs. But those are things to always keep at the forefront. I think, at least for our projects, that's how we practice this. And the other thing is to be humble. I mean, scientists, we don't know everything, and we will never know everything. To be humble about the questions that we ask and the projects that we take on, to make sure that the science can benefit. I mean, as an applied social scientist, at the end of the day, it's sort of, how is our work making a difference? Is it making a difference? How? Doing no harm with the science. I think it's also super important to do, and that we have to value multiple sources of knowledge to make sure that our work is moving in the right direction. And if it's not, to change it and to correct what we've done. So those are some of the things that we try to practice, and the ideals that we have, and it's an ongoing struggle for sure.
Thank you. And welcome back to the conversation, Dr. McCoy. We were just talking about what can we do to better privilege or center on equity in the work that we're doing. So whether it's research or practice, what can we do to make sure that equity is at the forefront and that we can promote that?
Well, I was going to say that I didn't even know the question, but what both people said, I was like, yeah, right on. More of that, whatever the question was. It was good stuff. So now I'm even more happy to hear that was the response to that question of how to get more equity. My mind went to, of course, hearing the scientists that are on the line from the vantage point of science. I was going to go to the opposite side because I love zagging when people zig, and, just sharing the scripture that, what does God require of thee? Whatever God is, if God is the universe, if God is whatever, an entity of being, or if God is yourself, what does God require thee? To love justice, to do justice, and to love mercy, and to walk humbly. Those three things are essential. If you let justice be your guide, what is fair, what is not fair, and to make justice more just, because justice is a theory. It's not in actuality from what we have achieved yet. But to love mercy So that means that when we mess up, mercy is essential. Scientists mess up, people of faith mess up, everybody in between messes up because we're all messed up. And then and the psychiatrist on the line can psychoanalyze me. We are messed up. We can become nihilistic. I believe that we have the worst in us and the best in us at all times, and we have to choose which one we wish to be. We have the greatest genius for horribleness, as seen by a president and others. And we have the greatest genius for goodness, as seen by individuals in time. But I do learn that he or she who learns must suffer. And so that means that what do we do to increase equity? It's important that some of us suffer who don't have to suffer. Because my greatest programs, policies, and procedures come when I literally suffered a little bit like those who have been suffering continuously that have less power than me. If you walk an inch in the moccasin of someone else, then you can have a greater perspective of what to do with that power that can take you for miles and for miles and miles. So empathy, in one word, is essential as a policy, but also as a practice. I also say this, is I like truth telling, and that's truth with the lowercase t, because I'm humble. I don't view my truth as a capital T truth always. So it's just one truth. There's many narratives of truth, but here's the issue. I think that we assume in America that equity is good. Some people in Europe and other places don't assume that equity is good. Equity is a means to an end to overturn the oppressive powers that someone else has had on you. I'm thinking of the Latinx leaders, Pablo Freire in Brazil and others, the Reconstructivists. They wanted to overturn this and get connected to the roots because of the oppressive nature of the power, regardless of the good of it. Just get them off of our backs, because we believe that we are worthy of independence from this pressure on our back. And that's a little bit different discussion than we've been having here, because America assumes this good. And that's a curious thing for scientists, because, it's in the area of morality. But now when we're in wartime, like COVID-19, where everybody's for themselves, what is good is bad, and what is bad is good, and what is up is down, and down is up, and everything's transparent, because, COVID in wartime against an invisible enemy makes it so. But in real war with bullets, the same is true. All morality changes, and it's just about surviving better. And so I just had to interject that, because someone put in the chat about reforming democracy and setting up structures to help people be ready for it for when it happens. That whole question is premised off of some good that's assumed behind this new version of whatever the democracy is. And it's behind the whole question of equity. Equity and ethics can never be untangled. And so I challenge each person to reevaluate, reassess the ethics behind their equity, and then kind of learn from others, be humble and learn from others to see if that ethic matches what another ethic may match, because it may be the wrong ethic. Good intentions could be the road to ruins. I say it this way: if Black people had the power that white people had, we are the majority across the world, people of color, but we are not the majority in power. But if we did have the power, might it look different, or might it be some version of the same? And did that already happen in 200 BC and before, when Black people, had Black people as servants and slaves? Didn't that already happen? And so we really have to work harder to. This is not an answer. We have more questions than solutions. And I love how we have a psychiatrist on the line in addition to us talking policy, because the psyche and the policy are just so entwined that you really have to know yourself a little bit better. And then once you know yourself, realize that that's a never-ending journey. So that's the truth for everybody. So to presume we can make a more perfect policy ever is an assumption. It has yet to be done. And so that's why America is messy. It's an experiment. That's why I believe equity is just a reiteration of equal from 40 years, 50 years ago, which is a reiteration of equitable from 40 years before that, which is a reiteration of human when we were not human. It's similar. It's just a little bit closer to what we feel comfortable with. So we just have to keep on pushing We need champions, we need advocates, we need real advocates that can make some things happen, but then we need to reassess and recalibrate and continue to improve. That's my 2 cents.
Thank you. Thank you very much. And thank you for answering that question that was in the chat for us. And we have about 5 minutes left now. I just wanted to put a plug in for our next series next Monday, October 19th, taking place at 6 p.m. to 7:15 p.m. The future of justice. And so we'll have some local people, including Kim Gardner, who will be talking about moving towards equity within justice. Before we hop off for this evening, the last question I have for our panelists is kind of picking up on where a number of you all have landed and thinking about the importance of framing equity. And I think Dr. McCoy raises a good question, is whether or not we truly want to answer that question. We talked about at the beginning, what is equity? If we're moving towards it, or we're pushing towards equity, how will we frame equity, especially for people who might not agree with us, who might not see the world the way that we do? So any parting words about framing equity as a way to make progress towards it?
Yeah, I guess I'll start. This is my first question I started on. So let me first thank you for having me on the panel. Let me secondly say I feel remiss in not saying everything I've done, because that's a habit, but because it's about doing more than speaking. Let's not clap, let's act, and so being the only district with 2 health-based school clinics, one with WashU being the partner of the Spot Clinic, 2 grocery store food hubs giving over 3 million pounds of food away with Fresh Time and Snooks as a provider, being 2 homeless shelters, the only with 2 homeless shelters, 2 therapists in every school, 2 therapists for staff, secondary trauma, before COVID, and all that was innovative. Wow, you're a trailblazer. Now it's barely enough. And so to the question that was asked, I will say on reframing equity, it's got to be about the doing more than the saying. People know it when they feel it. It's what love looks like in public with strangers. And when a stranger shows you love, you feel it, and that's equity. That's my story, and I'm sticking to it. And when I'm smarter, I'll come back to you with a better definition.
I think that's a really great and beautiful way to think about framing equity. Dr. Rogers.
I do think about this a lot because I'm someone who has a challenge understanding folks who don't really believe that equity is what should be centered, and so I do try to think about how could we have discussions with folks who don't believe the same as we do, that equity is something we should be striving toward. And so sometimes I think about just stepping back and saying, well, what kind of country do you want? What kind of place do you want to live in? Do you want to live somewhere where only certain people have privilege and everyone else is struggling and everyone else is, in poverty and not getting the education they need and not getting the healthcare is that the kind of place you want to be a part of? Because I don't know how else, if you don't and just inherently feel that equity and justice and fairness is what we should be striving to, that it is challenging for me to think of another way to frame that, because to me, it is just so central to who we are as human beings, that we are meant to care for each other. Now, I know Dr. McCoy said we should be murdering each other, but I'm all touchy-feely mental health-ish. So for me, I just kind of grew up sort of on the other testament, thinking about we're supposed to be taking care of each other, right? Like that is what has been really the thing that's driven me my whole life. And so it's always been a challenge for me understanding people who don't think that way, even though I am a psychiatrist and I spend a lot of time trying to understand people's motivations, emotions, and behaviors. That one has always been a challenge. And so just trying to reframe it as what kind of place do you want to be in, and what do you want to be a part of, is the only other way that I can think to reframe equity, if it's not something that you inherently recognize is part of humanity.
Dear moderator, may I ask for a 10-second rebuttal? My rebuttal is that you're killing me softly, Dr. Rogers. You're killing me softly. I love everybody. I don't want to murder anybody. I just want to be honest that people are murderous and there are monsters out there. And our president being one of them. And, you know, you got to know one to fight one. And so, but I don't want to murder.
I know you, I never thought you were saying, I just thought that you were saying that was what was sort of the natural tendency of humanity, which I certainly understand it from a trajectory over time, for sure. But I'm just saying that, you know, I take a little bit of the opposite viewpoint of humanity, that we were meant to be here to take care of each other. We're one of the few species that lives together, works together cooperatively. That's, you know, and so I think that that's what equity is about, is us coming together, working together toward fairness and justice.
Yeah, I couldn't have said it better. My previous two panelists have mentioned love, fairness, justice, and action. And I think all of those are encompassed. And I love this idea that this is about loving each other, loving our community and the social conditions that make everyone thrive. I think that to me is really, really important. Dr. McCoy, the focus on love is so critical because it is about the person, the community, and each other. And I think that's and Cynthia, the fairness piece is critical for this. So it encompasses all those pieces. I don't have any other definition. I think I'm just gonna go in that direction.
Got it. Thank you. I think that's a great place to end our discussion, focusing on love. We'll end on love. Thank you all for being here in the audience this evening. Thank you all to our esteemed panelists for giving us not just your thoughts and your time this evening, but a deep commitment to this really challenging work. And we really appreciate the work that you're doing out here in this struggle towards equity. Hopefully we'll see people next week, and really happy to be here as a moderator this evening. Wishing you all a great evening.
Thank you, Darrell, for everything. Yeah.
Great.